Hello, everyone. It's now 2 p.m. Eastern Time. You have joined part 2 of the fiscal year 20 Juvenile Justice and Mental Health Collaboration Program Orientation webinar. To allow for additional sign-ins past the hour, we will start in a couple minutes. Good afternoon, everyone. Thank you for joining today's fiscal year 20 Juvenile Justice and Mental Health Collaboration Program Orientation webinar, part 2. My name is Felicia Lopez-Wright, and I am a policy analyst at the Council of State Governments Justice Center. I will be facilitating the introduction of today's webinar. Next slide. So just to give you a summary of today's webinar, first we will introduce our speakers and provide an overview of BJA, the Justice and Mental Health Collaboration Program, or JMHCP, and the Council of State Governments Justice Center. Next, we will specifically review the Juvenile Justice and Mental Health Collaboration Program focus area and grantee cohort. Then we will discuss the planning and implementation guide and technical assistance, and hear from a grantee's experience with our TA, or technical assistance. Towards the end of the webinar, we'll also have some time for questions and answers. So before we go to the next slide, I'd also like to review our typical housekeeping items. So anytime during this webinar, if you have any questions, feel free to chat it into the chat box. This includes both technical and content-related questions. We'll reply to your technical questions in the chat window as we go along, but for the content-related questions, we like to keep that towards the end. So we'll do our best to get through as many questions as possible. If we don't get to your question, we'll follow up via email afterwards. If you encounter any technical or audio problems during the session, you can call Zoom live support at 1-888-799-0125. Please understand that there are some technical issues that you may not be able to resolve, but we are recording the webinar and we will email it to you as soon as it's available within the next week or so. Next slide, please. So for introductions, like I said, my name is Felicia Lopez-Wright. I am a policy analyst in the Behavioral Health Division at the CSG Justice Center. I am a licensed clinical social worker in the state of New Jersey with experience providing mental health therapy to youth, adults, and families in various settings. Additionally, I have experience with special education case management and short-term counseling at a community court program. I spend most of my time at the Justice Center providing technical assistance to JMHCP grantees focused on diversion, pretrial, courts, and reentry for people with behavioral health needs. I'm actually one of your assigned TA coaches for this grant track. Looking forward to working with some of you during the life of your grant and to help you achieve your goals. So if I haven't met you already, I'm looking forward to that. Moving along to Sarah. Sarah Wurzberg leads the substance addiction portfolio and is a social worker by training. She oversees training and technical assistance for the Second Chance Act substance use disorder and co-occurring disorders grantees. She assesses local and state behavioral health, housing, and justice systems to provide guidance to states involved in the Justice Reinvestment Initiative. Ethan Aronson is a policy analyst on the law enforcement team within the Behavioral Health Division here at CSG. He provides technical assistance to JMHCP grantees as well as the law enforcement mental health learning sites, and he's also another one of the TA coaches assigned to this grant track. Prior to joining the CSG Justice Center, Ethan worked at the Walter Rand Institute for Public Affairs, where he conducted needs assessments for local governments, as well as managing data collection and analysis for a project that supported reentry efforts for individuals with co-occurring diagnoses. Previously, he was a juvenile counselor in New Jersey and Oregon, helping to prepare clients for their return home after completing probation or parole. And last but not least, Stephanie Shaw is a project manager in the Behavioral Health Division, where she works to reduce the overuse of jail through initiatives such as Stepping Up, JMHCP, and the MacArthur Foundation's Safety and Justice Challenge. Stephanie has extensive experience working with youth and families involved in the justice system through direct service, research, technical assistance, and program design. Most recently, Stephanie was the Director of Violence Prevention at the Citizens Crime Commission of New York City, where she worked to enhance youth gun violence prevention by collaborating closely with government agencies and community-based organizations. Next slide. Thank you. Thanks. So I will continue now with an overview of the CSG Justice Center, BJA, the JMHCP program, and a little bit about OJJDP. We can move on to the next slide. Thank you. The Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide, please. So this slide describes our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide, please. Thank you. So here's an overview of the mission of BJA. So just to summarize, the Bureau of Justice Assistance, or BJA's mission, is to provide assistance to states, tribes, and local communities through grant programs and technical assistance. BJA's goal is to reduce and prevent crime and violence, support coordination and cooperation between different levels of government, hoping to improve system-wide collaboration. Through the development and implementation of policy, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. Next slide, please. Thank you. The goal of the JMHCP grant program is to support cross-system collaboration, to improve public safety responses and outcomes for people with mental illnesses or co-occurring mental illness and substance use who come into contact with the justice system. And as you can see here, since its inception in 2006, JMHCP has awarded 568 grantees across the nation. This includes 102 juvenile focus programs, and grantees have represented 49 states and 2 U.S. territories, American Samoa and Guam. So we at the Justice Center are proud to have been selected as the JMHCP technical assistance provider in partnership with BJA since 2006. And it's been great to have worked with a variety of grantees to support local programs across the country. Next slide. Thank you. As you can see here, currently $164 million have been awarded to grantees via the JMHCP grant program to improve public safety and responses to people with mental illnesses and co-occurring disorders in the criminal justice system. It's been really nice to see the consistent funding and also an increase in funding over the past couple of years as well. Next slide. Thank you. And just a little bit about OJJDP. I'm sure you've heard from Catherine Barry at this point. But since its founding in 1974, the Office of Juvenile Justice and Delinquency Prevention, or OJJDP, has provided national leadership to federal, state, tribe, and community efforts to respond to delinquency, strengthen the juvenile justice system, and to protect children. Next slide. So that's it from me. I'm going to turn it over to Sarah Wurzburg, who will continue with discussing the juvenile JMHCP program, objectives, and deliverables. Thank you.
Thanks, Felicia. Next slide, please. So the Justice and Mental Health Collaboration Program is really focused at the intersection, as it states, of mental illness and co-occurring substance use disorders, and really thinking about connections across the spectrum of the juvenile justice. And this year's the first year there's been the award through the Office of Juvenile Justice Delinquency Program, or OJJDP. So we're excited to be working with you under this new piece. The program has really been focused on these pieces, from crisis intervention training for youth for sites and really working on police mental health collaboration programs. We've had a lot of youth diversion programs that are really focused on some pretrial work and supervision strategies within the community. We also have worked with many specialty courts, so juvenile mental health courts, juvenile girls mental health courts, juvenile boys mental health courts, and different opportunities to focus on the co-occurring population within juvenile drug courts as well. We've also had experience working with people who are focused on juvenile detention and reentry. And it's exciting, as you'll hear from your colleagues today, that there's a broad spectrum of awardees under this year as well. So we're looking forward to continuing the work together. So we'll talk a bit more about this, but there are 8 of you, 8 different grantees that are working with it. And some of you are also actually past grantees through the Justice and Mental Health Collaboration Program. So we'll also be looking to you to share some experience about some of your work that you've already been able to do through this, and how this kind of builds on some of the system strategies that you have been working on over the years. Next slide. So this is, as we discussed on the first orientation webinar, this is really the 2-phased process. And while you have the 3-year time period, the first 4 to 6 months is really focused on the planning phase. And our goal in that is really to support you in making sure you have everything selected. So you've got your screening tool selected, you know what programs you're going to put in place, or evidence-based practices, setting up the data collection systems, and really thinking about the stakeholders that need to be engaged and brought to the table to better serve youth and their families. Next slide. And so within the planning phase, there's also a piece where you won't get all of your funding yet. So this is really meant to focus on the planning and implementation guide, which hopefully you already received from one of your TA coaches, either Felicia or Ethan. And that will really be the focus of the first period of this, to really go through that and make sure that you're set up for success and implementation. Then that will be sent to OJJDP to get approval, and then you'll get the release of the additional funds. Then within the implementation phase, you really get to start implementing the program. So really hitting the ground running on those pieces based upon the comprehensive planning process, and really starting up with the programming over the course of the next few years. So our support for that will be on answering any questions, bringing resources, and other opportunities that will help you all in terms of implementation. Next slide. So some of the key focus areas within the legislation and priorities for the Juvenile Justice and Mental Health Collaboration Program is mental health courts or other court-based programs for youth. So we know a couple of you will be focused on that area. There's a focus across all of these, both even in the adult grant side too, on the specialized training that can be provided across the justice and the mental health agencies to really increase the coordination and really build the responses across your communities. And then there's also the piece about making sure you're collaborating across the systems, and including the co-occurring substance use piece when it's applicable or part of your target population as well. And there's really the understanding that you'll be working with stakeholders across mental illness, across the juvenile justice system, and other youth serving systems that may support the youth and family, to make sure the connections are made, and to really support the intergovernmental cooperation for these different efforts. Next slide. So I'm going to turn it over to Ethan.
Thanks, Sarah. So all of the grantees on this call have different programs that utilize different approaches or focus on these different areas that Sarah was just talking about. So I'm going to go through this list here and ask that the main point of contact for each grantee team just introduce themselves to the group, give a short overview of your program so we can hear a little bit more about the approaches that you'll be utilizing. So if the point of contact from Bexar County could, if you're on the call, introduce yourself and a little bit about your program.
So hi, this is Jeannie Von Stoltz, and this is Bear County. It's spelled Bexar, but it's pronounced like the animal bear. It's really San Antonio. No, you're good. You're good. It's we're from San Antonio, Texas. It's basically one and the same. And we will be developing a mental health reentry court grant. Are developing a mental health reentry court for all children returning from residential treatment. And on the call also is Corey Schlepp and Elizabeth Davis, who are the probation supervisor and assistant supervisor for the specialized unit that oversees those children that are in residential placement.
Excellent, thanks so much. And do we have a representative from Cook County on the line?
Yes, hi. This is Brian Conant, the Juvenile Justice Behavioral Health Director for Cook County Health. And also on the call is Kay Hall, our Manager of Juvenile Justice Care Coordination. We are operating a care coordination program for justice-involved youth for Cook County. And so that's all the youth who are currently detained in Cook County in our detention center, but also any youth who is justice involved. We develop care plans and connect youth to services and do follow-up. And we have a number of different referral pathways that we utilize. The grant will support our expansion of this program to do more intensive care coordination for Cook County. And, we're excited to participate.
Wonderful, thanks so much. And do we have someone from Fort Bend on the call today? Okay, not to worry. What about a representative from?
I'm on for Fort Bend County, and I believe Dr. Almeida is also on as well. We can't hear you, Dr. Almeida, but I can see you talking. But I'm Faye James. I am the jail diversion coordinator, and Dr. Almeida is the director for our program. But we can't hear her, so she was the one trying to talk.
Got it. Okay, well, that's unfortunate. We won't be hearing from Connie. Sounds like we've got some technical difficulties going on, but let's move on to Lancaster County. And I do see we made a bit of a mistake here writing in Texas when Lancaster is actually in Nebraska, I believe. So could the point of contact from Lancaster, quick introduction? Okay, I know we have a couple Lancaster folks on the webinar with us today. Would someone be willing to give a quick overview of your program before we move on to Maryland?
Sure, I think we weren't sure who was going to do the talking here. My name's Tammy Lewis-Arndt. We're one of the Lancaster County partners through Centerpoint, and we are doing a mental health diversion program for adolescents.
Excellent, glad to have you with us today. Okay, so next up would be Maryland.
Can you hear me now?
Yes, is that Connie? Hi. Connie, wonderful. Okay, give us the rundown on Fort Bend.
Sorry, yeah, I got off my desktop and I'm onto my phone, so I'm not sure what's going on. So, and I'm not sure you can see me, but I'm here. Yeah, so we actually have a little bit of a different approach. Our focus is actually on law enforcement training around youth mental health issues and court personnel across the county. So we have a pretty robust crisis intervention team, and we're leveraging that in our partnerships with law enforcement and also the courts to really make that a big focus of what we're doing. So that's really the first phase. And then we followed by that, we really talk a lot about training providers also around evidence-based interventions for youth. We feel that that's a gap in our system. And then also looking at the development of an app that could be used not only by law enforcement, but by youth themselves in order to connect with services. So a little bit of a different approach.
Great. Well, appreciate you sharing. A very interesting program. I'm looking forward to working with you.
Yes, thank you, Ethan.
Okay, and so we are on to Maryland. Is there a representative from Maryland who could give us a quick overview of your program? All right, what about Minnesota? Is there a representative from Minnesota on the webinar today? Okay, not to worry.
Oh, sorry. Yep, Minnesota's here. There are a few of us here from Minnesota, and we're all probably just wondering who's stepping up to, who's got the baton. This is, my name is Callie Hargett, and I'm working in partnership with a few folks here representing the Minnesota Department of Corrections, Department of Health, and I'm Department of Public Safety. And so it's a tri-departmental effort to really accomplish three things. We're going to expand the juvenile healing to wellness court model in Minnesota. We're also going to issue a series of sub-awards to support culturally relevant mental health programming and solutions for youth. And then we're going to also distribute educational materials and offer training for a variety of audiences about mental health programming and access to programming.
Great. Sounds good. And do we have a representative from Monroe County?
Yes, hi. I'm Melissa Hayward. I am the Senior Manager for Children's Behavioral Health Services at our County Office of Mental Health. Also on the call with me today is Christine Durante, who is our Assistant Chief of Family Services at Probation. Adam Phillips, who is a supervisor, sorry, Adam, within the Office of Probation. And I think that I saw Barb Mitchell is also on the call. She's our juvenile justice planner that works within our DHS department, but in collaboration with probation and our OMH office. So we also are a collaborative group between DHS, OMH, and probation, working on this together. And we are looking at further developing, I should say, growing and enhancing a mental health specific caseload within our juvenile services department to work with kids who are identified as having more significant or higher needs related to mental health, behavioral health, substance use disorders, as well as expanding mental health treatment and service options available directly to those youth on probation by way of looking at contracting with an outside provider to be available right on site for those services for our youth.
Great, thank you. And last but certainly not least, we have Suffolk County.
Hi, how are you? My name is Allison Eberly. I'm the coordinator with the Child Welfare Court Improvement Project. I assist the team in making sure that their grant goals are being implemented. With this grant, we're looking to implement MDFT, multidimensional family therapy, with one of our partner agencies, which would also give them an opportunity for a direct link to health home care coordination and additional pro-social services for any juveniles and their families who are interested.
Awesome. Well, it sounds like we've got a great group here on the call with us today and a lot of really exciting programs. I'm grateful that you all were able to fill us in, and I am going to pass it over to Stephanie.
Thanks, Ethan. And sorry, Lancaster, I know you're in Nebraska. I just had a little mental slip with the Texas on the side. Okay, so to talk a little bit about how we approach juvenile justice at the Justice Center, I'm going to review 3 publications that our juvenile justice team has produced over the years. Just very briefly, there are links in the PowerPoint that we'll share that you can access these and read them on your own. But first and foremost is our guiding document around the 4 core principles of how we approach youth and the juvenile justice system. And the core concept here is really about matching youth to the needs that they have and the risks that they have that are leading to their involvement in the juvenile justice system. We really want to make sure that we are providing youth evidence-based services implemented with fidelity. And I know that is extremely difficult to do, but the more that we can work to implement interventions that meet youth needs, the more effective and positive outcomes youth will have in their future and current life. The second publication is around transforming the juvenile justice system and really digging into the key components and the key stakeholders that are involved in the juvenile justice system. And so really working to keep youth in the community as much as possible and with tailored supervision to the reason that they are involved in the justice system. So for example, really working to identify the key reasons and matching those probation conditions to those risks and needs, and rather than having blanketed long probation conditions that are difficult for young people to meet given their developmental stage. Also, interestingly, there has been some new research out of Washington around the need to look at subpopulations within our youth population that's involved in the juvenile justice system, and really working to match their needs based on their subgroup and not just as a whole. And we find that more effective outcomes are produced when we evaluate based on subpopulations and not just as an overarching group. And lastly, and very recently, our team conducted the first of its kind research around looking at youth involved in probation and the impact that that has on their school attendance. And we actually saw that youth that were on probation missed more school once they were on probation. And I know that one of our goals is to help youth stay in school and in other pro-social environments. And so we really want to look at what our goal is in working with youth across the board. And so again, we'll share these resources with you, but I just want to give you a super high level overview of the kind of research and approach we take when we're working with youth and jurisdictions across the country. And so now I'm going to talk a little bit more specifically about our work together. So as you all know, we provide training and technical assistance, and we do that through a variety of vehicles that we have available to us. I'm going to talk a little bit more specifically about each of these. So your TA coach, which are Felicia and Ethan, we're very lucky to have 2 really strong coaches on our team and really dedicated to the well-being of youth. They are your portal and entryway into all of the resources that we have. And the more that you talk with them about your success, your programs, your goals, your obstacles, the more that they can work and identify resources that will be really meaningful and advance your programs. And as you'll see here, we have a wide array of different types of engagements that we work with. So we have monthly calls with you all. We have our planning and implementation guide that I'm going to talk a little bit more about, along with setting goals within our technical assistance plan. We have a wide variety of publications, webinars, toolkits that we can share with you. We also work to connect grantees with each other, like we will do in our cohort throughout our working relationship together. We have learning communities both specific to the cohort and beyond. And then we also do site visits. Given the current COVID situation, we've been doing these virtually, and it's been really interesting to leverage different skill sets within our organization to implement our virtual site visits with the teams. And we hope that we'll be able to visit in person sometime soon in the future. And so to talk a little bit more specifically about the planning and implementation guide, so we have developed guides based on years of doing this work and really working to identify what helps create strong programs for both the immediate solution, cross-system collaboration, and long-term sustainability. And we have updated this guide and tailored it to your specific cohort of juvenile justice. And we've done that across all the tracks that we work on because we want this to be meaningful. And as you'll see, the questions, there are a series of questions that really work to help you identify key components, processes, and otherwise that will push your program forward and advance the impact of your work. The guide is divided into 7 sections, and we have an array of questions, again, that really help you work collaboratively as a team to identify and implement really strong problem-solving solutions. So here is just quick screenshots of some of the things within the guide that you all have. So you can see the table of contents here. It's very small text because it was across 2 pages. I pulled out just some more narrative-based questions, and then you can see we also have tables and yes/no questions. So a wide variety to really help you think about the work in a multitude of ways. And additionally, with your TA coach, you will develop technical assistance plans that guide your work. So the real purpose here is to identify key goals and deliverables that we need to work towards to have successful programs. And then the key steps that we can take and you can take across the lifetime of our grant program and technical assistance together. So these are things that we will continuously update, usually on a quarterly basis. In the beginning, we'll just work to identify key goals to get us started. And as we get into the work, we'll really spend time developing a plan and key steps that will help guide our work together. And as I mentioned before, we have a learning community that is specific to our cohort. So all of us will gather probably within the next few months, and we will leverage our relationships with national experts like the policy research associates and identify key topics that will advance your work. And so we'll also look to you to hear from you about what topics might be most useful and what you would like to learn about. So we will do this at least 4 times throughout the course of the first year of working together. And in addition to our cohort-specific learning community, we also have 2 learning communities. The first one is with the IJUST Institute, which is focused on people that are high utilizers and really looking at data and how can we integrate data across systems to identify people with significant needs and develop processes and programs that meet their needs holistically rather than working individually in our silos. We had this learning community will build on the learning community we did with IJUST last year, and we're happy to share any of that material if you're interested in data integration or building a data warehouse. Additionally, we have Dr. Faye Taxman, who will lead our data collection, information sharing, and evaluation learning community. This also builds on years of expertise and learning communities focused on this topic. And we're excited to see the learning community focused on this. This is always a big topic for our grantees, looking at our data and applying our data to advance our work. And in addition to these learning communities, we have a wide array of experts that we're able to pull in for one-on-one consultation, and we'll share who those experts are and the topics that they are strongly suited to discuss, and see how we can partner with them to, again, advance your work. So I know that some of you, if not many of you, have worked with us before, and I think it'd just be a great opportunity for us to discuss both what tips you might have for new grantees that have not worked with us, and any feedback for us that might help strengthen our work together in the coming year. I don't know, I'd like to just open up the floor to anybody that might want to chime in and provide feedback or tips to new grantees on any of the topics on the screen or otherwise.
Well, I'm going to go ahead and, this is Connie Almeida from Fort Bend County. I think my maybe advice is just to be patient with the systems, these projects, and of course, as you all know, not only involve multiple stakeholders at the local level. I mean, they're complex systems, but then we're also working with several stakeholders at the federal level, and it is challenging at times, but it does work. And I think what's been really reassuring for me is that we really are all on the same page, trying to improve the system for adults, children with mental illness, co-occurring mental illness, really make these improvements in the system to get people to the right care and keep them from being involved in the justice system. So that's really encouraging. It's not easy work. I mean, it's not, but it really is meaningful. And I think the fact, the support from the Council of State Governments and, BJA and has just been really great. So that's my 2 cents.
Thanks, Connie. Thanks so much.
So this is Jeannie from Bear County. We actually have had this grant twice before, and we're able to develop a girls' mental health court grant and a boys' mental health court grant, and both are sustaining. They've been sustaining for quite a while, even through different judges. We've had 4 different judges with the girls' mental health court grant. So what I would recommend is, I know that the P&I guide can look a bit daunting and overwhelming. Really use it as a roadmap and an opportunity for conversation with CSG instead of like a homework assignment. So we found it incredibly helpful, and it's really comprehensive in regards to thinking about all those factors that are going to help establish a sustainable program, right? Not just to get it up and running, but to really kind of think long-term about what data you need, what stakeholders you need in order to get the buy-in that's going to keep the program running in the long term. I think what's really exciting about this is, and I'm really happy that OJJDP has taken this over, is in the past we've been like 1 or 2 or 3 juvenile programs in a huge kind of grantee pool. And so to have 8 programs where we can really share and work with each other, because already I'm really interested in what's going on in the other communities, whether it's state or county. And, we're also willing to kind of answer any questions if you guys have any questions about our program. But I think the big thing is you're going to get, regular calls, really kind of put in the effort to prepare for those calls and have those questions, and take advantage of the experts that they have available. Because we were able to learn quite a bit about Medicaid resources, or how to bring in different community partners. All of that was really helpful by relying on kind of information from the experts.
Thank you. Thank you so much. Any other insights for new grantees from those of you that have worked with us before? Okay, well, and we look forward to connecting as a cohort. As Jeannie said, I do think it's going to be really valuable for us to be able to work together and learn from each other along the way. And if anyone wants to connect with anyone else just on an individual level, please feel free to reach out to your TA coach and let them know, and we can make that happen. Okay, so I would just like to open up the floor to any questions and hopefully have answers for you. But questions from you all about anything we discussed today, anything upcoming, anything at all. So I'm gonna actually stop sharing my screen so we can all see each other. So I'd love to hear any questions that you might have or that will help get us started. All right, no questions.
So Stephanie, I'll ask a question, and maybe it is someone's question. Can we talk a little bit about what it looks like to set up a schedule for TA calls and what that process typically looks like, and what the interaction often is with the TA coaches? If the site's new, it might be helpful to hear a bit more.
Sure, thanks, Sarah. So hopefully all of you have set up at least your first call with Felicia or Ethan. And in the beginning, we're really just working to onboard and get to know each other and your program a little bit, what changes might have occurred because of COVID or other factors that might have shifted our approach. And as we dig in, we really want to work to identify, again, like the initial set of goals and who should be on the calls with us to ensure strong cross-system collaboration, understand the various goals across stakeholders so we can really work to strengthen that conversation in your jurisdiction. Additionally, your calls will be on a monthly basis and they'll be an hour. We'll have agendas for you and really working through the P&I guide together. The P&I guide is designed in a way to walk through, as I believe Jeannie said, a roadmap of your program design process. And so I see your cat, Melissa. And so I think the P&I guide will really help us develop the ongoing agendas for the TA calls. And obviously, as things come up, we'll pull in experts. We can shift our strategy and use those calls to best problem solve whatever's coming up for you all. And then we will also utilize our TA plans in addition to the P&I guides, and as a way to make sure that we're taking the steps we need to take on our end to meet the needs that you all have in your various jurisdictions. Ethan, Felicia, you want to chime in on anything I might have missed?
I wanted to also say, I think my experience has been that it's a really great place for those candid, kind of honest discussions. You know, we all have kind of things happening politically in our different communities and jurisdictions, and CSG has been very thoughtful in how they kind of consider everything. I mean, they've had tons of experience working in different arenas and kind of really have a lot of knowledge on how to navigate any kind of collaboration challenges or policy challenges. So I'd encourage people to be really open on those monthly calls.
This is Connie Almeida. I had a follow-up question, and you know, we've had a BJA grant, so we're kind of still officially in our first year for the Stepping Up initiative. So I think part of my challenge has been like, who should be on those calls? And I know it varies by project and in you know, counties and so on. But you know, I think sometimes we have so many meetings, and in a lot of, obviously, you know, a core to these projects is collaboration. So, you know, that is one of the things that I have found challenging is, like, you know, the amount of meetings and really setting up those infrastructures that you bring people together when they need to be brought together in the right people. So I think, and I know, Stephanie, you talked a little bit about that I would love more just kind of insight or suggestions on, you know, how to make those monthly calls. Like, who should be on there from the local sites?
That's great.
Maybe just experience from others.
Oh yeah, if anyone else wants to chime in, please.
There's like 3 people, 20 people.
What I'll say, maybe to help frame some responses, is I think it depends on how we want to use that call. Do we want to use that call as the collaboration point? Do you want to use it as a place for your project coordinator to really then like problem solve and be open and honest about the obstacles, and then go back to the group, like in between work group or subgroup meetings? I think that strategy is dependent and can be flexible on the way that the project coordinator wants to approach the work and where the support is most needed. I think I've seen both of those dynamics play out across grantees. I'd love to hear from others on how you've approached this in the past.
I personally think it looks different during the planning and implementation phases as well. So like the planning phase, who you would have at the table is oftentimes might be more like advisory board type stakeholders, because you're really trying to flesh out some of the logistics to get to implementation. And then there's usually a different makeup of the implementation team. And then I think, you know, Stephanie's right in terms of there are different ways to use it, because it's justice and mental health collaboration. Often there is someone, of course, from, you know, the mental health system and the justice system as a part of that. I think it's really thinking about, likely oftentimes you already have monthly meetings. So whether this call is that part of this, or is there a way to build upon those times when you have case conferencing for different youth and their families to actually make it more strategic? And I certainly think there are times when it's just the program lead having frank discussions with us as well. So I think there's different strategies, but I really feel like the planning versus the implementation piece often changes the makeup of the call and who you think could be best used. Oftentimes also there's a research component of this project, and there is at least usually some calls, if not all the calls, where the research partner would be involved, or that we would be more focused on just talking about that. So some of that I think you can work out in terms of the implementation strategy with the TA plan. So if you want to focus a quarter on trauma-informed care, then we can think about who would work for that. And you want to focus a quarter on your research, then you could focus a quarter on that. So I think it's really a collaborative effort to try to figure out what works best for you. But I think you're asking exactly the right question. And I think that's something that hopefully your TA coach will work through with you. But curious to hear from others based upon your experience, what you've found most useful, or ideas on who you're thinking would be on these TA calls if you haven't had a grant before.
So we've historically used the regular calls as kind of those intimate conversations. But we have found that CSG has always been really willing to then add kind of additional support. I think Felicia mentioned that there's, you know, you're not just restricted to contact once a month. And with the site visits, that's a good time to kind of have those collaborative discussions. Or if there's a conversation with a researcher, that might be a whole separate conversation. So we've seen kind of a combination of things like Sarah said.
anyone considering having a collaborative group come to the monthly calls? And maybe can you talk a little bit, if yes, can you talk a little bit about how you got the buy-in for a long-term collaborative engagement on this?
I'm sorry, who did you direct that to?
It's just open to the floor.
Oh.
Thanks.
Making sure I I think you asked two questions, Stephanie. You know, I was so I think one was, how do you get the buy-in, right? And then how do you get people to come to the calls, right?
I think like buy-in for the calls and engagement in the project in this routine way, rather than like, yeah,
Right.
I'm a stakeholder and this is great, and you know, that long-term planning aspect.
Right. So, and I think in our current project, which has really been our first DOJ, sorry, funding, you know, the monthly calls really are our place to get that technical assistance, to really have those discussions like, oh, we have 50 measures and you're asking us to add 5, and you know, what's the value of that? How can we work this out? And I think those are really important for us to have that, because there's really no other vehicle for that. So I really, for us and for me, those monthly calls as a technical assistance are really, really important. Like, we need training on this, or what about these measures, or how do other sites do it, or data sharing agreements, or data integration. So I like the idea of keeping it small. And then I really think, you know, developing those relationships where we go back to that larger stakeholder group and we share that information. And, you know, we recognize, you know, we all work in political systems and judiciary, and so there's a lot of changes. And I think the person from Bear County talked about that. You know, we've just had elections, so we have new judges, new sheriffs, new constables. I mean, we get that, but you know, we just keep going with those relationships. And I think if the partners see us as, you know, first of all, trying to do the right thing, and then, you know, maybe the experts in something, I think that's important. So.
Yeah, thanks. All right, well, shifting gears just a little bit, I'd love to hear if anybody has any topics for our learning communities that we'll have together that would be of great interest to you and your project. And if you haven't participated in a learning community, it's a place where we usually do a presentation and host discussion about a critical piece of information that will advance your project. So for example, the IJS learning community, while the overarching goal is around data integration for high utilizers, there are a series of steps that we covered to discuss that topic at large with the group. So everything from getting buy-in from your stakeholders to identifying the key pieces of data, understanding the systems you have, and all the way to applying the data from the data warehouse to then like into your interventions. So for us, we'll have 4 sessions together with the policy research associates. And so we're currently working to shape up what that work will look like, and would love your input at this early stage. Of course, we will we will work to get your feedback along the way. But would love to hear if there are any burning topics that you're hungry for information for that will help your project, or any information on the periphery that will help expand or enhance the work you're doing. And so any ideas that anybody or requests would be really welcome at this time.
Hi, my name's Christine Durante. I'm from Monroe County in New York. And I just wanted to say that we've been, our group has been texting back and forth because we're just a little overwhelmed right now. This is our first time on here. So I feel bad just being one of the people that, you know, have run different meetings and stuff when there's awkward silence all the time. But I just wanted to say that we're looking forward to our first call, so then we can feel like we have some context to put around this. Just wanted to throw that. Oh, and I didn't have my video on, but I'm sorry.
Okay.
There.
Thank
Hi,
you
it's
so
me.
much.
So
hey.
there.
Thank you.
Yeah.
But so I just wanted to throw that out there that, you know, we're like, oh my God, what are we supposed to say? We don't want to sound disrespectful, but we're overwhelmed and blah, blah, blah. So I just wanted to throw that out there.
I appreciate you chiming in. And I know that this is a lot of information to digest, especially if you have not worked with us before. I would like to use the time we had together to brainstorm and get started on the work. But of course, this is just an introduction, and just seeking any like immediate ideas people might have had that they're hungry to share. But I appreciate you sharing.
I'm sure we're a very chatty bunch, so I'm sure we'll have a lot more to say after our call. So.
Excellent, excellent. Really glad to have you here. All right, well, I appreciate everyone taking time today and coming and attending our second orientation webinar. We really look forward to working with you. We're going to circulate the PowerPoint. It has all of our emails and links to the resources that we shared today. And I know that your first calls with Ethan and Felicia will be excellent, and know that Sarah and I are also here to support your work, along with the many of us in our division and beyond. And if you have any questions, please feel free to reach out to us. And thank you all so much, and I hope you have a great rest of the day. Thanks, everyone.